Thank you for waiting. We'd like to start today's keynote speeches. First of all, let me introduce today's distinguished presenters. Firstly, we will have Dr. Rafael Laguens, the President of World Veterinary Association. In the second keynote speech, we are supposed to have Dr. Samuel Stefanskadam from Livestock and Aquaculture Bill and Melinda Gates Foundation. Unfortunately, he is not able to attend. After the 10 minutes break, we will have Dr. Tracey Goldstein, Director of One Health Institute in Colorado State University. In the final keynote speech, we'll have Dr. Kayoko Shioda, Assistant Professor at Boston University. Let me introduce today's chairperson, Dr. Fumihiko Yokota, Associate Professor of Kyushu University. Then the VIA chairperson is Dr. Kazuhiko Imamura, Secretary General of FABA One Health Fukuoka office. After the keynote speeches, all speakers are invited to participate in a general discussion. We'd like to make this forum more interactive, where audience are welcome to ask any question they may have during the presentations. Please take a look at the handout on your desk with instructions on how to ask questions. You can submit the questions by accessing the QR code for each presenter, each presentation listed on the paper from your smartphone or tablet. If you'd like to ask more than one question, please click Submit Another Answer on the screen that appears after sending your question, and post your question again. Questions can be posted anonymously during the presentation and will be included in the Q&A session. With a smartphone or tablet, you can also ask a question on paper, which will be collected during the break after all lectures. So from now on, I will pass the microphone to Dr. Yokota and Dr. Imamura. Thank you very much. Hello, everyone. My name is Yokota Fumihiko from Kyushu University. It's a great pleasure to serve as a chairperson. I'm a little bit nervous, though. I really appreciate this opportunity to learn about the One Health approach. Thank you very much. Hello, everyone. I'm a Secretary General of FABA One Health Fukuoka office, Imamura. So I will support the chairperson, Dr. Yokota. Today, our themes are the connect between the One Health and well-being, so which are very important for animals and humans. So I want to encourage you to ask questions as many as possible. So just let's get started. And please enjoy this time and by learning all the lectures. So the first presenter is Dr. Rafael Laguens. Please welcome with a large applause. So let me introduce the profile of the doctors. You can see the page number 5. Please refer to this introduction.
For me to be today with you. What I try to do in my presentation is to make some reflections about the dialogue between the veterinary medicine, the animal medicine, and the human medicine, and how this dialogue help to the well-being of humans and animals. This dialogue is between the two professions, but One Health is an issue of all citizens, all professions, all sectors. Let me start with my personal CV. My very personal CV is that I have been born in the house of my grandfather, and my grandfather was a physician. That means I start my life in the house of a physician, in the home of a physician. And I spent most part of my childhood with my grandfather and my godfather, that was a physician also. That means that my dialogue with the medical profession started when I was a child. I worked during 27 years as veterinary public health officer in my country, Spain, and that made me have a direct contact with farmers, food business operator, physicians, nurses, pharmacists, environmental professionals, decision makers, and many others. That means the key person of One Health. My wife also, she's a physician, and I talk about her profession and my profession every day. One Health exercise every day. I want to have some reflections about the word veterinarian. The word veterinarian that we use in English, in Spanish, in French, in many languages, comes from the Latin word veterinarius. That means veterinarium means beast of burden. That means that they understand that they were the people that take care of the health of these animals. But nowadays, veterinarians are more than that. Even though the Oxford English Dictionary define veterinary medicine as the science of practice of the diagnostics, treatments, and prevention of disease of animals, originally especially farm and domestic animals. Nowadays, as I say, the veterinary profession is very much more than that. And of course, the veterinarians have another meaning, that is the person qualified to treat diseases. I prefer more the English word to mention veterinarian, because according to my poor understanding of Japanese, is animal doctor. And veterinary medicine is the medicine of the animals. It's the same in German. Tiermedicine and Tierarzt means medicine of the animals and doctors of the animals. I think this definition, if I start this, the title of this presentation, I will mention the dialogue between animal medicine and human medicine, and I will explain why later. In my brief go through the history, since the prehistory, we can find schools from humans and animals with the trepanation holes. That means that in some way or other, humans try to make medical practices. And the question is, this finding in the schools of animals, that was on purpose to treat this animal, or was for practicing, for use this treatment for humans? We never know. We have not written any written, but the first writings about when it started the history, that was in the beginning of the civilization, at least in the Western world, is in the Mesopotamic, Sumerians, Assyrio-Babylonians, Egyptian, and Hebrews, start the civilization, and with the civilization also the agriculture and the medicine, both medicines, human and animal. But these first medicines and the first documents can be the Code of Hammurabi and some papyrus of Egypt. But at that time, the medicine, that was the same people treat the animals and treat the persons. And there was a lot of influence from religion and healers. That was the beginning of the medicine. When we can say that the start, we recognize the medicine was in the Greek, in the classic Greek. You can see here Hippocrates. Hippocrates is considered the father of the medicine. We veterinarians, we consider him also the father of the veterinary medicine. And in what treatise called Treatise on Air, Waters, and Places, he mentioned the influence of the places, of the environment, in the health of the people, in the health and the well-being of the people. And in this well-being, in this environment, there was also the animals. Other famous philosophers, scientists, we can say, is Aristotle. Aristotle was the father of the zoology, was the father of the anatomy, both human and animal, and he wrote a text called History of Animals. Again, the interconnection of both medicines. Physicians in Greece at that time, they used to treat both animals and humans. Even the physicians, they treat horses, because there was an animal very, very important at that time. In this nice picture that I share with you is a picture of Rafael, is in the Vatican in Rome, and they show the Athens school. We can consider that as the first school, because there was, you can see there many philosophers, you can see many scientists of that time, and in the middle of the picture, we can find Plato and Aristotle. It's said that the Greeks, they don't profound more in animals, in animal medicine, and in general, because there were some ideas, philosophical, that they focus more in humans and in the spirit and so on. And if we make a close of the picture, we can find in the right side Aristotle with the hand going to the down, to the heart, and Plato pointing to the heaven. That means the ideas of Plato, they were more idealistic, spirituals, and so on, and he paid more attention on these ideas, and Aristotle was more pragmatical, there was more on the reality, analyzing the reality. Probably that's happening in all of us. Both sides of the human being are important, the spirits, and at the end of the day, we need to not forget that we are animals, rational animals, but we are animals. Then we need to take in consideration that. And this discussion started in Greece. This discussion, and probably because that sometimes we move more from one side another. In classical Rome, they continue doing the medicine like the Greek. In fact, they hire many Greek medicines. They go to Rome, and that's start the word veterinarius that I mentioned before, because for the Greek was a very dry country, very poor country. The agriculture was not so developed like in Rome, but in Rome they was very developed, and it was very important for Romans to have people that take care of the animals. In the Middle Ages, they forget the learning of the classical Greece, and the medicine in general, not only human but animal, was a little bit in decrease, was not very well developed. That was a time of stagnation, and there was, at that time, there was the druids and these kind of people that use amulet, they use some plants and so on to treat but with no science, because science doesn't exist at that time. In Christianity, they move more to this way of the spiritualism and so on, the religion, and at that moment start some first step of the medicine that we can, not the first step, the barbers, barber surgeon, they perform both things. They cut the hair, they shave, but at the same time, they use this instrument to make some surgical treatment. And in the field of the animals, there were the farriers that not only take care of the shoes of the horses, but also treat the diseases. Were the Arabs in the Middle Ages that take the texts of the Greeks, they to again to Europe, because they keep this classical knowledge, and they take back to us, to the civilization. In the Renaissance, these classical texts kept by the Arabs were more studied, and they started more the humanism, replaced the dogma. The religious dogma in some way opposed at that time to the science. They start the anatomy with important people like Leonardo da Vinci. There was not only artists, you know that they did many things, including studying anatomy. And at the end of the Renaissance, they start the scientific revolution. They start to develop the biology, anatomy, chemistry, physics, mathematics, astronomy. After the scientific revolution came the Age of Enlightenment that comprised 17th century and 8th centuries, the encyclopedia, the French encyclopedia, and after that, many social revolutions, many social changes, the French Revolution. That time, there was the rejection of social and religious constraint, and they thought that the science and technology would be able to curing all kinds of diseases. At that time, the Galen erroneous theories, they were abandoned, and many important discoveries, many important achievements, they were come to the humankind through the microscope. The science discovered the microbes, the smallpox vaccination start to be introduced, and a very important thing also to human and animal medicine. The circulation of blood was discovered. And that was discovered by William Harvey. William Harvey, a British physician, an English physician, he discovered the blood circulation theory. And it's important, you can see in the right the title of his book. His book is Exercitatio Anatomica de Motu Cordis et Sanguinis in Animalibus. I would put the attention in animalibus. Even we don't know Latin, we understand animalibus from the animals. But it's curious, because this book that published first in Latin, the science was done in Latin at that time, that was in 1628, but several years later, in 1653, he published the same book in English. And in the title of the book, concerning the motion of the heart and blood, they don't put animals. Again, it's like try to forget that animals, because in this book, of course, many of the research was done in animals, in the body of animals. You cannot perform at that time the necropsies. And that was done. That means, again, the connection between the human medicine and the animal medicine. We use animals to make research and know that we are not that different. Harvey studied in Parma University, was one of the more important at that time. Harvey dissected, when he came from Padua to London, he started to work their own project. In Padua, he worked with Professor Fabricius, that was a professor that was taking the knowledge of Aristotle, that we mentioned before, to the current times. And he used dissections of animals, many dissections. Professor Fabricius, and after Professor Fabricius, Harvey in London, make a lot of vivisections and a lot of dissection of animals, dogs, eels, crows, or even wasps. Of course, he makes some when possible, because you know that human bodies you cannot use. Some criminals, they can use for making some dissections. He used like that, but most of the research was done on animals. He used careful observation and reasoning using the Bacon scientific methodology. That means Harvey not only discovered the blood circulation, but also apply the scientific method for medicine, in general, but for medicine. And his discovery was very controversial. He kept the research for several years, commenting with the rest of physicians. When the rest of physicians said, okay, it's okay, we agree on you, they publish. But you can see how difficult was doing these things. And one thing that I discovered preparing this lecture, I go to the history, not only of the veterinary medicine, but for the human medicine, is in this book that I mentioned before, Harvey said the following: so the heart is the center of life, the sun of the microcosm, as the sun himself may be called the heart of the world. They make an analogy between the macrocosm of the body of an animal, of the human being, and he say the heart is the sun of the body, but at the same time they say, and if I compare with the microcosm, the sun is the heart of the world. For me, that sounds a little bit like planetary medicine. It's a kind of premonition of what's going to happen in the future. We need to, because everything is interconnected, but it's a kind of intuition in this microcosm, macrocosm analogy. And Harvey couldn't understand the oxygen and the blood, because at that time the oxygen was discovered a little later, but another scientist, Robert Boyle, makes some experimentation in this nice picture also. He showed in this experiment, you can see a bear in a crystal ball, and they try to show the need of air as essential for the life. For sure, I suppose in this condition the bear died. But you can see in this picture the reaction of the people around, the interest of the scientists to discover, but also the feelings, the reaction of some people being worried for the well-being of the animals. For me, that was the beginning of the science, but that was the beginning of the awareness of the society, of the importance of the science, but also of the importance of the well-being of the animals. Just a brief history of the teaching of the medicine. The first school in Western world, that was the school of Salerno in the south of Italy, where many of the texts of the Greeks were translated and taken from with Constantine from Africa to Europe. In this part of Italy and the south of France, that was developed at that time, the medicine. Another important school at that time, the school of Salerno, that was in the 11th century. In the following century, that was the Montpellier Faculty of Medicine, that still exists, is the oldest school, medicine school that still is. And again, in the 1623, you can see here the Padua University, the Padua where Harvey studied and made the first step to discover the blood circulation. And I start to talk about in this century, in the 18th century, France was the most evolved country in the world. That was the illustration that I mentioned before, the King's Song, the Sun King, all this, everything was developed in France. And in this environment, that is not by chance, that was created the first veterinary school ever in 1761. And it's interconnected. You can see in the left side one hospital called l'Hôtel Dieu from Lyon in France. And there was a person, named Claude Bourgelat. He was not physician, he was not veterinarian, he was squire of the king. Was a people that know a lot of things about horses. He was director of the Lyon Riding Academy, but he was interested in anatomy, physiology of the animals, and he observed that the knowledge at that time was very, very poor, was very not scientific. And he has some friends, physician friends, and together they had the idea to open a veterinary school, a school that teach the diseases of the animals. And another connection with both medicines is that the place where was founded the first veterinary school, that was a place that was owned by the hospital Hotel Dieu de Lyon, and they hired this part. That means it's against the interconnection of both. We can see here Claude Bourgelat. As I mentioned, he was, at that time, the animal medicine was with the stable workers, was performed by the stable workers, knackers, people from the slaughterhouses, shepherds, marshals, and he tried to do that in a scientific way. Honor Fragonard was a surgeon that was the first director of the first veterinary school, and also he was surgeon and anatomist, and was also the first director of the second veterinary school that was in Paris. At that time, I think the medicine was more developed. Not only surgeons become also physicians, not only barbers and surgeons. They gain credibility, they gain status, and that was, in my opinion, at that time, that was created the medicine, the whole medicine, the human and the animal medicine, and the surgeons, they were integrated in the medicine. It's very interesting, this physician, this French physician. He was Dr. Regent of the Faculty of Medicine in Paris. He was member of the Royal Academy of France of Science. He was Commissioner General for Epidemics in France. He was physician of Marie Antoinette Queen, but he was also professor of the Alfort Veterinary School. And he proposed a law that was not approved, in which he said, why separate medicine of animals of that of men? And he proposed to unify both professions in one school. Probably that was too much. But anyway, the idea of this dialogue, the idea of this one medicine. In the school, the third school, that was the school of Vienna, and in this school, in the faculty, in the medicine school, that was created during a brief time, a chair of cattle diseases. That was with a physician, that was the director of this chair, Dr. Jonathan Goblin. That means, again, Vienna School is a very, very, very good example of the interconnection of both medicines, because some human doctors, they were professors of both schools. Here, simply, I want to mention the different, in this case, is the Royal College of Surgeons and the Royal College of Veterinary Surgeons. At that time, there was the Industrial Revolution, and not only we need to create both professions, we need to regulate the practice of both professions. And again, both professions, the physicians and veterinarians, they work together developing this kind of structures to regulate the practice of the profession. And talking about well-being, that is the topic of this meeting. The World Health Organization defined human health as health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. When I mention health, I think on that. We need to think on that. We work for that as physicians and as veterinarians. And these associations, or these organizations, define veterinary public health as the sum of all contributions to the physical, mental, and social well-being of humans through an understanding and application of veterinary science. That means veterinarians. We are not veterinarians because we like animals. Veterinarians, we are veterinarians because we look for the well-being, the health of the humans and the animals. And the World Organization for Animal Health considers veterinary service as global public good. And defined in some documents about veterinary education, they say, all veterinarians, regardless of their professional area of practice, after graduation, are responsible for promoting animal health, animal welfare, animal well-being, veterinary public health, and food safety. Again, public health, remember, we are talking, we need to have in mind the well-being of humans. My association, the association that I am president, we have an agreement, cooperation agreement with the World Organization for Animal Health. And in this agreement, we have, of course, antimicrobial resistance as something to talk and as something to work, rabies, education, but also, it's very important, part of the agreement said, when we talk about One Health, we need to advocate for better integration of veterinary services in One Health projects, an initiative at all levels, including legal framework to reduce the risk of and prevent future pandemics. That means the profession, the veterinary profession, need to work together with physicians and the rest of the sectors to prevent future pandemics. We, physicians and veterinarians, we won a couple of difficult diseases. One is smallpox, that was eradicated in 1918 by the physicians, but also there was a very, very, very problematic disease, that is called rinderpest, that was killed a lot of animals, destroyed many economies in the world, and that was eradicated by veterinarians and farmers and so on in 2011. This year is very important, the intergovernmental negotiation body, because the World Organization for Animal Health recognized the devastating failure of international community to demonstrate solidarity and equity in response to the COVID-19 pandemic. And the World Health Organization established this intergovernmental body in order to create a convention agreement, or other international instrument on pandemic prevention, preparedness, and response. Try to avoid the next pandemic. We need to negotiate that, and we don't need to forget, as veterinarians, we need to tell the World Health Organization the importance of One Health, the importance of pandemic prevention and public health surveillance, but also the importance of avoid spillovers, because if we don't avoid spillovers, we are going to have another pandemic. Antimicrobial resistance, again, is very important. It's not the only thing that we work in One Health, veterinarians, but here is very important. Here is one meeting of the antimicrobial resistant multi-stakeholder partnership platform. That was an inaugural session a couple of months ago in Rome. And here we take the voice of the profession in that. And remember that the veterinary medical use of antimicrobials is necessary to protect animal health and improve animal welfare, but also non-veterinary medical use, for instance, as growth promoter, need to be avoided, need to be finished. We are going to do a congress this year in Cape Town in a couple of months, and we are going to discuss about coordinated and sustainable actions to contain antimicrobial resistance. This is just to mention that, as you know, physicians take care of humans, but in our planet there are more than 74,000 species of vertebrates. Any of these species that have some disease, they call to a veterinarian to try to heal this animal. That means it's a big responsibility that we do using the techniques of the medicine, all medicine. In the left side, you can see a picture of a Finnish veterinarian that she is performing anesthesiology for any kind of animals, including this small animal used that almost is like a alien. But also, there are some veterinarians in Canary Islands that they make dissections of whales in order to to know what have happened with this whale. You can see here, these are different places where veterinarians treat animals. You can see here a scan and CT scan. You can see here equine operation room that is similar to all the technology we use, is like in humans, diagnostics and so on. That, again, shows that we are practicing the same medicine. Very important also, not only specific things. We need to, as veterinarians, as physicians, we need to watch, we need to try to finish with the nuclear wars, because that is very dangerous for, also we need to look at after the climate change together. We have a good dialogue at the level of big associations. You can see some pictures of people that are here, but the dialogue needs to continue at ground level with any day between physicians and veterinarians. This is a good example of this dialogue. You can see here Peter Doherty, this is a veterinarian, and also Rolf Zinker-Nagel, both of them together with the dialogue, they win the Nobel Prize of Medicine or of Physiology in 1996. And thank you very much for being here today, and thank you very much not only for being here today, but also for all the work Fukuoka is doing for One Health, the policymakers of Fukuoka, the citizens. Thank you very much.
Rafael 先生、ありがとうございました。Rafael 先生。
Thank you very much, Dr. Rafael. Thank you very much. Let us give a big hand once again to Dr. Rafael. Now we'd like to have a 15-minute question and answer session. And so, ladies and gentlemen, you have a QR code at your hand, and please send your questions to him. And I know that some questions are coming already, and so we still have time to receive more questions. Please feel free to ask questions. Now, all right, now, okay, let's get started. And let me begin with my own question. I would like to ask Dr. Rafael. And so in your presentation, and so you looked over the history of the human the health and animal health, and then you gave a broad overview. And in summary, so the human health and the medicine, and so helped to develop veterinary medicine. And veterinary medicine and the care of the animals were also beneficial for this advancing human health. So overall, there had been a collaboration between human medicine and animal medicine. So this is my impression, which I have received from your presentation. Is my understanding correct?
In fact, I have been reflecting on these issues, and my conclusion in this moment, medicine, is one medicine. And humans demand this medicine for themselves and for the animals they take care. And the animals can be their own pet that live at home, and they consider in these days, many of the people, part of the family, but they demand medicine for farm animals, they demand for zoo animals, and they demand also for wild animals. Because we as human beings, we want to keep animals, biodiversity, because it's good for us. It's good for it's not sometimes in one meeting, in a meeting of human doctors in the World Medical Association meeting, one of the, in the corridor, some people come to me and say, well, but what do you prefer, humans or animals? I say, humans, I am a human. But we work for humans. And because other humans like animals and came to us and demand for treatment. No animal come directly to a veterinarian to ask him for in general. Maybe some could be, but no one is it's a human that come. That means we are working for humans. I don't know if I complete your reflection about that. Nowadays, I am convinced is the one medicine. And we need to put on the service of the human. That is the one that pay this medicine and develop this medicine. That's my understanding. I hope physicians understand that, because in the other side, you imagine there are thousands and thousands of veterinary clinics open around the world, treating cancer, treating many diseases. If all this data, through artificial intelligence, could put and analyze, that means that we will find a lot of data that could be used also in human medicine directly. I think we need to forget any kind of competition and dialogue. And I think we do. I think I feel very comfortable with the physicians Fukuoka physicians that I meet here, because there is very easy dialogue with them. I think we need to import this example of Fukuoka to the rest of the world. It's not to compete. We are working in the same, with different species, only change the species. And of course, there is more resources for humans than for, I don't know, guacamayos or any other species. But that's my impression, honestly.
Thank you very much. Now, so I think the relevant to your comment, we have one question from the floor, and so the animal medicine and also the human medicine and the medical professionals, and so these two professions are separate. However, so when I hear from Dr. Rafael, so we understand that both medicines have to collaborate, and so collaboration and coordination may require some education and training. And so where would it take place? Like what kind of approaches are taken in high schools or colleges and specialized schools? So from the viewpoint of education, how can we enhance dialogues and collaboration between two medicines, human medicines, animal medicines?
To start in the schools, in the high schools, even in the try to teach to the child, as is done here in Fukuoka, this working with the schools, because it's an essential idea that everything is interconnected, and this child, they have dogs, they have pets at home, and they need to know how to treat. They need to know how to respect. They need to know which are the risks to the pets and to you, to the human. Then I think this need to be integrated. Some of the discussions that sent me a physician told me once, a physician that, you can hear me? Yeah, a physician came to me and said, in the records, that was in Spain, in the records, you go to the records of a human, and it's not compulsory to put if you have a pet or not at home. I think that will be, he said, that will be, because it's important to have the whole picture of the family. Of course, if you have some disease, you go and say, no, I have an allergy because I have a cat. No, I think we need to have that since the beginning. Then, yes, and of course, that the education starts in the school, in the universities also, of course, in the veterinary schools, in the medicine schools, and in nurses schools and so on, for sure. Need to be a connection. In Europe, once we did together, working with physicians, an association of physicians, association of dentists and veterinarians, we make a common document sent to all the deans of the veterinary schools of Europe, asking for education in One Health. These kind of movements need to be, because it's good for everyone. If not, we are not going to have a sustainable planet. In my opinion, we are going to repeat pandemic once again and again. It's necessary for humans, not for guacamayos.
ありがとうございました。あと
Thank you. Yeah, we still have 5 minutes, and so we have 2 questions.
環境を考える統一的
Is there any comprehensive discipline to think about environment? And also what is the effect that have an impact on the one health?
I want to excuse to all of you because, in fact, I start to talk too much and I finished. I couldn't do my presentation, my last slide, a little bit more, explaining more. But one of the slides mentioned the importance of the environment. 2 examples. Our last Congress that was happened in Taiwan, Taipei, not far away from here. Our One Health Summit was environment, an essential part of One Health. And yes, one of the slides I mentioned that was regarding the antimicrobial resistance and regarding also fight against the next pandemic is the quadripartite, and the quadripartite is composed by WHO, the World Organization for Animal Health, FAO, and United Nations Programme for Environment. Yes, of course. The title of my presentation was the dialogue between the 2 medicines, but together, and I mentioned at the beginning, this dialogue is not among us. The health is not among physicians and veterinarians. The health is about the society, and there are many, many, many other, including people that work in environment. And yes, from here, I go to Australia because I discovered this year, that was the last time I came to Fukuoka, Mark Ship from Australia, he mentioned an initiative in Australia that is called Vets for Climate Action. You know that Australia, they have these wildfires, they have this drought, they have these floods, and there are a lot of consciousness on that. There is a farm movement for Action Climate, veterinarians and physicians. They are working together. We have a role to play for the environment, for sure. And we have the triple crisis, that is climate change, that is loss of biodiversity, and this pollution. We as physicians, we as veterinarians, we need to work together in our practices, for sure. No. But there was only 30 minutes to develop my presentation. But yes, totally agree.
あとは2つ
So there are another 2 questions, but we will discuss those 2 in a general discussion. So that time is up. Thank you very much for your presentation. So now we will have a 10 minutes break. The keynote speech number 3 is start 3:15. Please come back to the seat by then.
皆様、まもなく基調講演3を開始いたします。お席にお戻りくださいますようお願い申し上げます。
Thank you for waiting. Please have a seat in a few minutes.
はい、それではお時間となりましたので。
Thank you very much for waiting. So we will start the session, the second half. Now we'd like to have a different distinguished speaker. We will have Dr. Tracey Goldstein. She is a director of One Health Institute, Colorado State University.
Thank you very much. And I want to thank Dr. Karachi for inviting me and the organizing committee and the Fukuoka Prefecture for this putting on this amazing session. It's been an honor, and I'm very pleased to be here. Today, what I thought I would do is talk just a little bit about the One Health Institute that I am fortunate to lead at Colorado State, and then I'll talk a little bit about a good One Health example that we have implemented to work with infectious diseases. So, of course, we've talked about this a lot, but really it's this interconnection between the health of the environment, animals, and people, and how we can address all of them together in order to solve these big challenges facing the world today. So you've probably seen various versions of this, and I really like the Fukuoka emblem around One Health, but really what we're talking about is this center in the middle, that intersection of where animals, human, and environmental health come together. And really, in order to address these problems, we need a transdisciplinary approach. There's no one field or discipline that can address these big problems. So you need to pull together veterinary medicine, human medicine, the social sciences, engineering, earth sciences, ecology, business, liberal arts, all of the various disciplines. And so I think it's important that everybody sees a home and a role for them and their work in One Health. And of course, we're addressing these very, very large problems that are facing the world. So we're seeing large drivers like land use change or sea use change, climate change, economic development, globalization, and all of these are leading to these very big complex problems, some of which you've heard about today. I'll talk more about zoonotic diseases, but we've heard about environmental contamination, AMR, food safety, food security, loss of biodiversity, and there's many other things around safety and security that are all affected. But the big piece here really is it's human behavior that's really changing this. And until we can understand that human behavior piece, we won't be able to solve these problems. So human culture, economics, policy, education, and as I said, behavior are the big pieces here that are so critical. And so bringing in our social scientists and our other behavioral specialists is going to be very important. Otherwise, we can come up with solutions, but we won't be able to implement them in communities. So the One Health Institute began in 2013, and the previous dean of the vet school, Mark Stetter, wanted the institute to be at the university level. Often institutes are at the college level, but here we work at the university level across all 8 colleges. So veterinary medicine, human medicine, public health, liberal arts, engineering, I have to remember them all now, agriculture, natural sciences, business. So really pulling in everybody to recognize that there's a place. The One Health Institute has 3 main pillars. I'm not going to talk much about One Health, One Medicine. I think Dr. Laguens did a very good job of that today. And of course, the underpinning framework is that we must address all 3 aspects: human, animals, and the environment. And then, of course, the community. We work very, very closely with the community in Fort Collins, but also beyond in Colorado. And one of the things we're in the middle of right now, which we're very proud of, is a class that we co-teach with the city of Fort Collins to address issues in the city. And we do that together with the students, the faculty, and then the leaders in the community. We also fund different projects. We funded some work around One Health and climate change, and right now we're actually funding some pilot projects to do One Health issues in a community-based project. And of course, pilot funding for One Health is really important because there's no one ministry or no one funding stream for that. So we need to use different ways to get some pilot data to then be able to apply for funds to do some bigger work. So just briefly, I'll give you some examples of the type of research we do. So the One Health Institute supports research, service, and education. And in terms of research, we have a broad range of things we do. One big project is funded by the National Science Foundation that's looking at the air, so the aerobiome, understanding what's in the air, what's under the air, and how that changes pathogens, contaminants, and other things that move. We also have the Colorado Clinical Translation Studies Institute. This is funded by NIH, and it's a large partnership with Colorado State University and many human medical universities and human hospitals. And the idea there is to link what we learn about the health and treatments of animals and how that can benefit people, and then vice versa. So CSU, of course, leads on the animal health models, and then we work closely with our human health partners. And then we also are funding a transdisciplinary approach to look at human-wildlife coexistence. In Colorado and in many other places, there's a lot of conflict between wildlife, carnivores, wolves, jaguars, depending on what part of the world, and of course, ranchers that are trying to protect their animals. And so we're trying to understand how we might be able to improve coexistence and improve outreach so that we can better live together, because we need those animals just like the wildlife need their space. We also, which is different than some of the One Health Institutes in the US, we do a fair amount of work looking at human-animal interactions, trying to understand that human-animal bond and how that benefits both the health of course, people and animals. Also, right now, as you're all aware, there are many effects around the world that are changing temperatures, so increases and decreases, extreme weather, extreme fires. And we know that agricultural workers who are out there and livestock workers are being affected by what's happening in the environment as well as those animals, and really trying to understand how can we improve that in terms of if we can improve the environment for the people taking care of the animals will also be more productive. And then finally, we do a fair amount of work trying to support unhomed or homeless people and their animals, or people with low resources that need additional support, much like the work that's being done here in Fukuoka. And then, of course, the One Health approach to emerging infectious diseases. I think we all recognize this is a really important approach to take, and I was very fortunate to be a part of an 11-year USAID-funded project that is the biggest One Health project to date that I will talk about. So as we all know, we just had the worst pandemic in history. We're trying to recover from that. It probably won't be the last one. But how did we get here? Well, it comes back to the environment. We all are seeing around us unprecedented global change, and this is affecting air, land, and sea. We're seeing loss of species, we're seeing degradation of habitat, we're seeing increased pollution, and then with that, we're starting to see animals and people having to change where they go and how they interact in order to adjust to this new environment that they're in. And of course, we're very aware that we're seeing a warming planet. These are some images taken from the ocean between Alaska and Russia, and these are the highest temperatures we've seen ever on record. And in some years, the ice no longer even forms between the two countries. And so with that, we're seeing huge effects on human health. We're seeing loss of homes, loss of livelihoods, and of course, extreme damage from things like fire. And we also know that there's a strong interaction between changing climate and infectious diseases. So we see animals changing where they're going, and with that, any of the parasites that they may be carrying move with them. We also see things like mosquitoes able to live in more northern or southern latitudes than they used to. And with that, we're seeing more infectious diseases. So of course, the viruses, we've been in a global outbreak of avian influenza now for almost 2 years, and that doesn't seem to be ending. Coronaviruses, we're all very familiar. Ebola, Marburg, Nipah virus, I'll talk about some of these. But the vector-borne diseases are very much expanding. We see things like dengue virus, West Nile virus, malaria, almost globally now. And of course, bacteria and parasites are increasing as well. So what's happening is we're seeing emerging infectious diseases and outbreaks increase, and we see them more often, and we see more severe outbreaks. So one of the biggest challenges facing One Health today is addressing emerging infectious diseases, and this is a multifaceted problem. First, I think many of you are aware, the majority of these come from animals, and in fact, 75% of these come from wildlife, and that is something that often people don't recognize. So, and it's usually human activities that are linked to the spillover of the viruses from animals to people. So examples are Nipah virus in Malaysia and Bangladesh and in Cambodia, SARS 1 and of course 2, so COVID, we also think came from animals, Ebola. But not just Ebola, we can go back many, many years, and HIV came from animals as well. So this is a long history of having spillover from wildlife in particular. And the important piece here is that One Health starts in communities and then ends in communities. This is where you see the cases. This is where you see the sick people. This is where you see the effects of the diseases. And if we want to be able to solve these problems, we need to work with communities, understand the behavior, understand the cultural activities, and understand what's important to them so that we can figure out how to improve that. So when you think about sort of this pathway of disease emergence, we know that viruses circulate in animals, they circulate in people, and they're there often naturally. And then sometimes there's mixing in unusual ways, right? So that people and animals may come in contact, and these viruses may have the opportunity to move. And every once in a while, they spill over to a human and then become very good at actually amplifying in a person. COVID did that. And once they're able to do that, they can transmit between people, and then very quickly they can spread around the world. So understanding all of these different steps and what we can do to stop that is very important. So looking at this in a different way, we think about many different viruses that are often circulating in animals. Here we have some bats and rodents and primates. And they often circulate in these animals, and they don't make the animals sick. Every once in a while, something happens, some kind of contact, and a virus may move from an animal into domestic species. Nipah virus is an example. It moves often from bats into pigs, and then from pigs into people. So sometimes it can become amplified in the pigs and then make people sick. But then there are other ones that, like Ebola virus, that can go directly from a wild animal into a person, amplify in the person, and then cause a big outbreak. So understanding these different viruses and what animals carry which ones is important to understand how we can prevent transmission. So in many countries, including the US, this is sort of the state of the situation. Cases may occur. Let me see if I can point. Cases may occur, and they may go undetected for quite a while. Eventually, somebody might recognize, or doctors might recognize, there's a change in a type of disease or more deaths, and then they'll begin to do lab confirmation. And then by the time it's time to respond, it's quite late. And this is very expensive for lives and resources and economies. So if we're able to have a surveillance system that is looking for these viruses and other pathogens before, you have communities that are educated, that understand how to recognize when there's suddenly new deaths or different types of deaths, and they have a way to report that out. And then labs that are trained that can do the testing and then report, then you can respond much quicker, and of course, there's much less loss of lives and resources. So this was the premise behind the USAID work, was could we develop a coordinated One Health surveillance strategy that could help to reduce spillover? And in particular, when we think about surveillance systems, often there's surveillance systems for people and then for livestock. And often they're not the same pathogens. Avian influenza is one different example where we're looking at in both animals and in people. And then the important piece is wildlife is often left out of the equation. So one of the things we want to do is bring all of those together and then test them all for the same types of pathogens so that you could start to compare what's happening in these different populations. So what that means is bringing together a One Health team of veterinarians, medical doctors, nurses, biologists together into communities to do this work together. And then in addition to that, we would also do investigations, of course, during disease outbreaks and work with local hospitals. So that way you're seeing what's happening in the communities and you can share that information with the doctors in the hospitals so that information can go both ways. So when you're trying to think about a big project, we were working in 30 countries. When you're trying to think about a big project, you have to figure out what you want to target. And this is different depending on the type of virus or pathogen that you're looking for. So we know, of course, that primates are closely related to us, and they carry some similar things such as HIV. Bats, I think many of you are now very familiar with bats, but they carry many different pathogens. Rodents also, and rodents and bats live very close to us in our houses and around us. And then, of course, depending on the different species, the different diseases, birds can be very important. Of course, pigs, carnivores, and of course, humans are an important piece to all of this. So we were targeting these different species depending on the type of diseases and areas we were in the world. Of course, across the world, there are many different places where there's different types of risky contact with animals and people, and this varies. So you're seeing just some examples of the places that we worked. Of course, when MERS came onto the scene, we had to change and be a little bit flexible to try to look at what was happening between camels and other species. Of course, we know that there's a lot of interaction between different bird species and pigs that allows for switching and transmission of influenza viruses. A lot of urbanization, people are bringing their animals into the cities and have urban wildlife, and there's a lot of different opportunity for contact. So we worked in many different places, but importantly, I wasn't the one doing the work. We had teams on the ground that knew where the important places were to work. We trained them to do the work, and they worked closely with their governments to share that information. So like I said, one of the things we wanted to do was train a disease surveillance workforce. Often when you go into countries, veterinarians have experience working with small animals, sometimes livestock, often not with wildlife. So we did a lot of training so that the veterinarians and other medical folks could learn how to collect samples safely, how to wear the correct PPE, how to transport the samples safely from where we were in the field to the lab. And these are some examples of us working in West Africa. We were working to do some Ebola virus work. And so, of course, the PPE might have to change depending on where you're working and what you're looking for. And then, of course, into the lab. At the time, I was at UC Davis, and so we had many laboratory technicians come from all over the world to my lab. We went to labs around the country. My lab technicians went everywhere. And we also did twinning. So, for example, staff from Laos went to Cambodia for training so that way we could increase capacity around the world. And human behavior, I keep saying that this is key. Human behavior is the key to everything. We can understand the viruses, we can understand which animals may carry them, we can even understand where the animals live and maybe the timing of spillover. But if we don't figure out the human behavior that makes animals and people come in contact, we will have no luck in terms of trying to change that. And so we did many different types of studies, some sort of large qualitative studies, doing large surveys, trying to understand animal contact, some more deep dives in communities, really trying to pull apart different things. And then anytime we collected samples, we always asked questions to to the people around their contact, what animals, what they did for work, if they went into the forest, why they went into the forest, so that we could bring all of this information together so that we could understand how we could begin to target any type of intervention strategies. So when you're trying to think about this, you need to cast a wide net. One of the other sort of difficulties with our surveillance system is often we test for one thing at a time. we see hemorrhagic disease and we test for Ebola. Oh, if that's negative, then maybe Marburg. Oh, if that's negative, maybe Rafael fever. So what we wanted to do was do some broad testing. We called it family testing. So we could test for all coronaviruses, for example, in one PCR assay, and we could use the same test in wildlife, livestock, domestic animals, and people. That way you could compare the information. From there, you would do PCR, and then if you got a positive, then you could do sequencing to confirm it, and then full genome sequencing, so understanding the entire pathogen to try to better understand how it might be related to a known pathogen. And then finally, you start to do that experimental work and epidemiologic work to try to understand the risk, and the risk is where the key is. So we were able to sort of look at this at broad scales. You could look at sort of at a global scale, different species that might exist and the type of risks you think might be occurring based on the information, and then drop down to that individual species virus level to really try to understand how might a virus be transmitting. So for example, we know coronaviruses are often shed in oral secretions or in rectal secretions, but wanting to understand how SARS-CoV-2 is spread is different than trying to understand how some of the other respiratory coronaviruses are spread. So this is what we wanted to do with the project. So I'm going to use coronaviruses because I think these are all top of mind, and we did a fair amount of work. So first of all, before SARS-CoV-2 came, there had been 6 other human coronaviruses. Many of these cause mild disease, right? So 229E, NL63, these cause common colds every year and often did. We had seen some severe outbreaks from SARS-CoV-1 and MERS, and then of course SARS-CoV-2 really changed our understanding and what we think about coronaviruses. And what's really interesting and what people didn't recognize, that all of these coronaviruses have some kind of link to animals, sometimes bats, sometimes cattle, but always links to other animals. And so we wanted to understand more about these viruses. So we did a large study over 30 countries, and what we found was the majority of these viruses were found in bats. We wanted to understand more about this. So what you can see here is a map showing the distribution of bats. So where you see red, you see more bats, and where you see green, there's less bats. And you can see we found a high concentration of viruses where we find many different types of bats. We also found, we sort of extrapolated based on what we found, that there's about 3,000 still to detect unknown coronaviruses in the world in bats. This would be expensive, but not as expensive as responding to the COVID-19 pandemic. So investing in this is very important. Finally, we also found that certain types of coronaviruses were related to certain types of bats. So we now know that rhinolophid bats are very important for understanding where we might find SARS coronaviruses. And this is very important information because we can use this to target where we do our surveillance. So this is another map, this time showing just the SARS coronaviruses that we found, as well as the species that we think carry these viruses. So again, you can see these red hotspot areas in China and Southeast Asia, which we expect, right? We know that that's where SARS-1 and SARS-2 came from before. But look, there's also these big spots in Africa. So the important lesson here is we have to stop thinking about the past. We have to stop thinking about where viruses came from before. But we must be thinking about where animals are living and looking at the risk where they're living, and then understanding how people are coming in contact with them. And in fact, when we went back after the pandemic began, we went back and we looked at some of our samples from Laos and Cambodia and other places and found relatives of SARS coronaviruses in these bats in Cambodia. So this tells us, again, another clue of how to protect the world in the future. Very briefly, I'm just going to talk a little bit about our work about Ebola viruses, another example of some of the benefits of this type of work. So for many of you are probably aware that despite many 40 years of outbreaks, we still have no idea what the bat reservoir is. And there were 5 different species of Ebola virus that all caused different outbreaks: Zaire, Bundibujo, Sudan, Thai forest, and Reston. And what we do know is that past outbreaks seem to be linked from people coming in contact with primates, but the evidence is there that suggests that it comes from bats. And USAID asked, after the large outbreak in West Africa, if we would shift some of our activities and try to see if we could understand the reservoir of the virus. So we went and we did a very large survey out there, going from urban to rural to forest areas. We were looking at reservoir species like bats, rodents, and primates, but also potential spillover, right? There was lots of questions about, did it get into dogs and cats and pigs and sheep, and then could it get back into people? And then we also went at multiple different samplings from the dry season to the wet season and multiple years. And we think that's important. For example, CDC has done a lot of work with Marburg virus, and we know that those bats are usually positive at the end of the wet season when they have their new pups. And so we think different times of the year is important for when viruses may be shed, and that's important for how to protect people. So in the process of our work, we found a new type of Ebola virus in bats inside people's homes. And this was really critical, right? When you find an Ebola virus in people's homes, you immediately want to understand a little bit more about it. And in particular, this virus was carried by 2 different bat species that were spread quite widely across Africa. And so that told us 2 things. One, the risk for Ebola viruses, just like with coronaviruses, is much wider. We have to stop thinking that we only see outbreaks in DRC. We have to think about where do the bats live and be prepared for outbreaks in other places. So we did some work to try to understand how much of a pathogen it was, how did it compare to Zaire, how important was this type of virus. And these are the types of things you can do once you find something new to understand, is this of high risk or low risk? Is it something that we should worry about? While we were there, however, we also found for the first time in a work with CDC, Marburg virus in Sierra Leone. This was 24,000 kilometers west of where we typically had seen Marburg virus outbreaks. So this is really important. Also, we found it in bats in a new place before there were even diseases in people. So immediately we worked with the community to first do some education around that, and more importantly, we worked with the hospitals and the labs to be able to test for Marburg virus as well. So that way, they were prepared if there were new outbreaks. And in fact, as we saw, and many of you probably remember, in 2022 and 2023, there were Marburg viruses in new countries that we'd never had it before. And those countries and labs were prepared. The doctors knew to test, and the labs were trained to do the testing. And we think that was a part of why the outbreaks were not as large as, as they could have been. So again, I'm going to end back with communities. Community is where you need to start and end your work. One of the reasons I think the project was successful is when we found results, first we shared it across sectors. Remember I said we went into the field in a multi-sectoral team, and then we shared the results across all the ministries so that all the ministries together could work with us to inform. And then we went back to the communities and provided the results and then had discussions about what can we do to protect people. And in particular, when we found the Bombali virus and the Marburg virus, it was very important to work with the communities to understand how they came in contact with bats and how to protect them. And so we developed this book called Living Safely with Bats that had both words and pictures that we could go back and do community education. So just the last few things, and I think it's been alluded to already today. In sort of the wake of the COVID-19 pandemic, the One Health approach is become, a very common term, right? We see it in the US, we see it as a part of the Biden-Harris administration. There's a new bold 100-day mission that is all based on the One Health approach and how to implement it. We already heard the WHO Pandemic Treaty and the revision of the international health regulations is all incorporating the One Health approach. We see it now in G20 and G7 documents. There's a new pandemic fund, and I think one of the issues that we're struggling with still is people know the word now, they know it's important, but they don't always understand how to implement it and how it benefits communities. And so the opportunity is now. I think if we and institutes like the new institute that will be built here don't know how to implement it and show the benefits of it, the interest will go away. And so it's very important. And the one thing that's so critical is to incorporate in local communities and local and indigenous knowledge and into the research, because they are the key to the success. So I think that this is a critical role now for institutes like mine, institutes like you're building here, and all of the programs to do successful work for the world. And with that, I'm going to say thank you, and I'm happy to take any questions.
Tracey 先生、ありがとうございました。Thank you very much. それでは15分間。
Thank you very much for your presentation. And we have 15 minutes, and we already received numerous questions and the audience, and so that you have time to send questions so that we can receive your questions. So that we already got 9 questions so far. So the one thing, so that I'd like to ask one question. So the Dr. Tracey. So the wild animal surveillance and the results and of the wildlife and surveillance and the results. So the information about the results can be shared in the community as well. So that this is really important. Knowing is very important. That you mentioned that, and so the surveillance of wildlife and the results and the outcomes and to be shared and in so the human health and then to the community. So that this is the very so that this requires a comprehensive skill, so that human and the resource development is necessary, and how. So that do you develop those human resources in your university and the laboratory and so-called generalist and engaging in the public health, and could you share your sort of experience?
That's a very long question, but very, very important. So first, on the sharing of data. So that's a very critical problem that the world is struggling with. With the project, what we did, this is making a weird noise, I'll take that off. With the project, what we did is we had an open platform where we had all of the data that we shared. We also shared it monthly with all of the governments, all 3 ministries, all got the reports, and we usually had a meeting where we could discuss it, and then also to the communities. We also, any of the sequences we shared on global databases such as GenBank, for example, so that the world could access them. I think the longer term solution is to have a database that globally links human data, animal data, wildlife data, habitat, animal distribution. That's very complicated. The WHO is working on that very closely with the FAO and others. There's a lot of issues around data governance and data sharing, but I think we have to figure out how to get over that so that we can have things shared. In Colorado right now, there's an effort underway actually to develop a platform for Northern Colorado where that's exactly going to happen, to bring the livestock, the wildlife and the human data together, at least in a dashboard, so that people know what's happening. So I think that's the first piece, is we need to understand and we need to solve this issue around data sharing and start to have a global system. There are global systems that exist for other things. You know, you look at environmental data. IUS is a global system that collects data in the ocean that shares it with everybody. We need that for infectious diseases. And then in terms of capacity building, I think there's many different ways to do that, and we have to address it at different levels. So FAO, for example, is very important at the national level. So they work with the national labs and do a lot of training at the national level. One of the other things that USAID funded was the One Health Workforce Next Generation project, and that focused on universities in Africa and Asia to develop both the faculty and the student programs so that you're building this next generation of One Health practitioners and having them trained in the labs or in the field. And then, of course, the lab is the part that that I was, I feel very close to, where we spend, it's a lot of work and a lot of effort, but to make sure that you're getting out into the labs and training people so that they have different tools in their toolbox so that they can, use the right, sort of have the knowledge to use the right one when they need to. It's a long-term thing, and there's a lot of turnover in a lot of agencies and facilities, as you all know. So it's something that's going to take a lot of work, but I think very important to do.
Thank you very much. Well, thank you very much. Now, we still have some time for questions. Thank you very much for so many questions. And so the bats. And how come the bats can become such a huge risk of many infectious diseases? Is it something related to where they live or the ecosystem that they depend on?
Good question. It's not actually just bats. Bats happen to be what we think the host for certain viruses, like coronaviruses and Ebola viruses. But if we were talking about hantaviruses, or if we were talking about, oh my goodness, why am I forgetting other families? Rodents would, okay, I'll just stick with hantavirus. Rodents would be very important. And if we talk about influenza viruses, we know pigs and birds are very important. So we don't really understand why different groups of animals are the host for different viruses, but bats aren't the only ones. They just happen to carry some of the ones that we've been talking about recently. So I think it's a combination of where the animals live, that their type of life history, behavior, and then also how they come in contact with people that leads to transmission.
ありがとうございます。
Thank you very much. Let's move on to the next question. And wild animals and the livestock, pets, and so there is the reservoir research of those animals and the result of such data and research results, and how can we link those data with the real research of One Health?
The question. I think the question is, how do we link results from wildlife and research, and then what can we learn from that? Practical. Okay. I think the first thing is we need to recognize, often people think that the diseases come, it's one direction, and it comes from the wildlife into the livestock, and often these things are moving in both directions depending on the environments. I think we first have to understand that, and then understand the contact between the animals, so you can start to think about, how can you protect animals. One interesting that's happening now in Colorado for a number of different reasons is they're putting, they're testing collars on cattle that they can use to remotely move the cattle around on the landscape. So they're doing that initially to be able to manage them without fences, which we know is important and hard to manage. And then also you can protect the environment. If you can move cattle to one area and they can graze, and then move them again to a different area so that they don't overgraze, it helps the environment. But potentially there's some ideas about, is there a way to understand where the animals are going and where the carnivores are, and then to be able to move them and manage them, or maybe at night bring them closer to different areas where the animals are. So there's things like that. But I think sharing is the key. There's not a lot of always surveillance in wildlife, like I already said. There's some surveillance in livestock, but nobody's sharing that information. So we need to, again, make sure that when we have results, it's not just going to the livestock ministry, it's going to the human ministry, the environment ministry, so that that information can be shared and ultimately go into a database where that information can be available and shared.
ありがとうございました。
Thank you very much. No, yes. So you hit a very important viewpoint. And so yesterday, and you talked. So So in Miyama City in Fukuoka Prefecture, and there is going to be a new establishment of One Health. And that establishment is exactly where the linked activities by linking the data and information between human health and animal health will take place. And in the United States, so do you have a system to manage centrally about the data from all sources, and so if you have one, and so did you have difficulties, and what difficulties did you have, or if you're going to have one, then what kind of benefits are expected?
Good question. So we in the United States are very good at telling everybody what should be done, but we don't always do it ourselves. So the data sharing issues in the United States are just as difficult as everywhere else. So that work that we did in 30 countries, and that was the places that we were making progress. But there is no agency right now funding that type of work in the US. There is a new center at the CDC for predictive analytics, and right now what that center is doing is focusing on if there's an outbreak or if there's new cases, predicting what's going to happen, and that includes movement across borders. Their hope, if they get more money and if they can expand their team, because I've discussed this with them many times, telling them they have to, is to think about that upstream work and make sure that they're figuring out how to involve the animal, the wildlife, the environmental health sector. But right now they're focusing on the other. So that doesn't exist at all. And this is partly why in Fort Collins, so Fort Collins is, they sometimes call it the West Washington, D.C. All of the federal agencies actually have offices in Fort Collins. And that is why we're talking about forming this sort of shared database where we can start to share it. But that's just one part of the country where we're trying to do that. But I think if we can show it's possible and see some of the benefits, maybe there's some other opportunities. But no, the US does not have that, and we need to solve that problem along with the rest of the world.
ありがとうございます。はい。
Thank you very much. So about Ebola virus. So after all these years of efforts, humans cannot beat Ebola virus yet. Why is that?
Another good question. Well, number one, we don't know what bat it lives in, and that's part of the problem. For many years, people were doing a lot of work thinking that they lived in the big fruit bats. And the reason they did that was because they were finding antibodies, so evidence of previous infection. But some of the recent work that we did, both where we found the Bombali virus and we actually found Zaire Ebola in another insectivorous bat in Liberia, the evidence is now suggesting that we were looking in the wrong places. So it comes back to understanding what is the species and how people are coming in contact. So I'll use Marburg virus as an example. Marburg, we know the host. We know that it's the Egyptian fruit bat, and we know that they live in caves. The CDC has done some very good work to show there's certain times of the year where those bats shed more virus and where the young have the virus. And so that is the time that they're most infectious and people are most at risk. So if you can prevent people going into the caves at certain times of the year, then you can prevent disease. And so some things you can sort of do more broadly, and other things you have to know a little bit more specifics about the animals. And so there's a lot of work to be done to still understand Ebola viruses and their reservoirs. But I think in the last 10 years, there's been some good research, and I think we'll start to get more good information about the host. At least I'm hoping.
Thank you very much. Well, so we still have some time for the last question. Maybe this is going to be the last question. So in the United States, and the rabies, so it's a scary disease, rabies. But so for rabies control, so I would like to know, so the responses that done by the universities or the publics or the medical institutions. So is there any effort to control rabies in the United States? So how the rabies are conceived by the public?
I think the situation with rabies is a little bit different than in many other places around the world. So in the U.S., in most cities and counties and states, you're required to license your dog, and a part of that is rabies vaccination. So in the US, we have a different problem. When we have rabies cases, it's usually linked to a skunk or a bat or a fox or some type of wild reservoir that bites a person. So really control has been vaccination. And as we know, that's a big, big challenge in many other countries. And there's obviously many organizations, and I'm sure Dr. Laguens would want to talk more about that. But I think this is a big area of effort. And in fact, the One Health Workforce project that I was telling you about that USAID funds, rabies and rabies control and rabies education is one of the main focuses for that project in all of the countries. And so they're using that to both train people already working in the government ministries as well as universities, so the next generation, doing community education, doing vaccine campaigns, etc. Because I do think that vaccination and sort of helping to manage feral dog and cat populations is really the key. So again, it's a human problem, right? There are many feral animals because of us and our behavior. So, you know, we have to tackle the human problem, we have to get our animals vaccinated, and then the surveillance, of course, that's needed. But I think the surveillance systems are usually pretty good at picking up rabies cases, but those other pieces that are much harder often fall by the wayside.
Tracey 先生、
Dr. Tracey, thank you very much for kindly answering all the questions. Let us give a big hand once again to Dr. Tracey. Thank you.
Now, we'd like to move on to the final keynote speech. Dr. Kayoko Shioda, the Assistant Professor of Boston University. As for her profile, please refer to the information in the brochure.
Thank you so much. I have been debating whether I want to do it in Japanese or English, but most of my professional training has been in English, actually, so it's easier for me to do it in English, but probably I will answer questions in Japanese, if that's okay. So the title of my presentation is Achieving One Health from Infectious Disease Research, and how we can ensure the health and well-being of humans and animals. So for the One Health research that I lead, we focus on diarrheal diseases. And diarrhea has been decreasing worldwide, we know that, but it still causes quite a large number of deaths. For example, in 2015, it's a little bit outdated, but 1.3 million deaths were caused by diarrhea, and 500,000 deaths were in children under 5. And this is the third leading cause of death in children. And diarrhea also contributes to undernutrition and stunting, affecting 162 million children. That's a really big number. And diarrhea and gastroenteritis lead to long-term cognitive deficits and poorer academic performance and lower economic productivity in adulthood. So it's not just acute diarrhea we're talking about, but it has long-term downstream effect on people's lives. If you take a look at the map, you can see that it disproportionately affects African countries and South Asian countries. And WHO has a big goal to reduce stunting in children by 40% by 2025. So it's a very important international problem that we have to solve. So from here, I want to explain how the diarrheal diseases and One Health are related to each other. So animal feces, they carry pathogens causing diarrheal death in children. So I know it's a really small font size, but the message from this pie chart is that pathogens transmitted in animal feces accounts for 28.3% of all the pathogens. So many of the pathogens are transmitted or carried in animal feces. Here's just a small quiz, but when we think about animal feces and human feces, what do you think? Which one would be more? Which one do we see more in the world? Animal feces or human feces? Animal, yes. Do you know how many more animal feces are out there compared to human feces? It's actually 4 times, but it's a big amount. So there are 4 times more animal feces than human feces globally, and it's a big number there. So animal feces is also increasing globally, and poultry, which is what we focus in our research, is the fastest growing sector. So domestic animals such as chickens, cattle, sheep, and pigs, they generate 85% of the world's fecal waste. So it's a really big number. And then the global livestock population has been rapidly expanding, and there are about 24 billion animals. And poultry is the fastest growing subsector of livestock, which has grown by 250% in 30 years in low and middle income countries. This is the photo of the small scale broiler chicken farm in Maputo, Mozambique that our research team took. And then the reason why we focus on chickens in our research is that they also carry pathogens responsible for the highest burden of foodborne disease. And if you go to low-income countries, which may not have enough resources to build infrastructure for biosecurity, you see a lot of these situations. So they don't have access to adequate water to clean the surface of the markets or the cutting boards and knives, and they only have one bowl of water that they have to use throughout the day. So the biosecurity and food security is a big issue. And people can be infected from infected by various pathogens through various sources and routes. That is why it is really difficult to control zoonotic pathogens. For example, the pathogens in animal feces can be transmitted through water or fields, flies, or contaminated dirty fingers or fomites. And these things can also contaminate food, which will infect people. And poultry farming, as I said, has a risk of human illness. But at the same time, poultry farming is promoted as a development strategy in low-income countries, which is what Dr. Sebase Gayam talked in his presentation earlier. But chickens serve as the primary source of animal protein and income and food security in many, many countries. So they contribute to multiple Sustainable Development Goals, SDGs. And poultry farming empowers the youth and women. So there are lots of benefits associated with poultry farms. So now we learned that there are good aspects of poultry farming, which contributes to well-being, nutrition, and income, and empowerment. At the same time, there are some negative aspects, which is the health risks. The chickens carry important enteropathogens that cause illness among especially children, that cause diarrhea and vomiting. So the point is that it is important to ensure food safety while enabling the community to benefit from poultry farming. So that's the background of our study, why we wanted to do this study in Maputo, Mozambique. Maputo is the capital city in Mozambique. And our study name is called Cheep Cheep. Cheep Cheep is like, in Japanese, it's like chun chun, like Kayoko no nakigoe desu ne. So it's actually the acronym, Children's Exposures and Enteric Pathogens in Children Exposed Through Environmental Pathways. This is before the ChatGPT came out. So the PIs, Karen Levy and Matt Freeman, came up with this really cool name. I'm really impressed with their naming skills. It's really cool. But in Maputo, the characteristics of Maputo is that 70% of chicken production is informal. So it's not like a large animal farming facility, but it's more like a small scale and informal, non-regulated system. And 90% of households purchase foods from the informal sector. It's not from like a supermarket, but it's more from informal wet markets or street stores and so on. And children in Mozambique are infected with enteropathogens carried by chickens. So this is why we thought it's a really important setting to conduct this study and understand why these pathogens are important and how people are exposed to these pathogens. So our research questions, the first one was, what are the locations and behaviors that expose children to chickens? And the second question was, where along the chicken value chain are key poultry-associated pathogens found? And then we wondered, what is the risk of childhood exposure to enteropathogens of poultry origin in Maputo, Mozambique? And what are the potential strategies to mitigate the risk in this setting? So let's look at how we address the first research question. In order to understand what are the locations and behaviors that expose children to chickens, we conducted stakeholder interviews between June 2019 and July 2021 in Maputo. And we interviewed 77 people, stakeholders. And our objective was to map chicken value chains. As I said, most of the people are purchasing chicken products from informal system, meaning that we don't really know how the informal market works in Mozambique. So we first wanted to understand how the informal value chain works in Mozambique, and then understand where chickens and their products are reared, distributed, butchered, and sold. So from the chicks to chickens to eggs, and chickens to meat. So we wanted to understand how this chicken value chain works in Mozambique. Excuse me. There are 3 types of chickens in Maputo: broiler and layer and indigenous chickens. So broilers are for meat and layers are for eggs. And the indigenous chickens produce both eggs and meat, and it's more like a free-range chickens. So we discovered the chicken value chain for each type of chickens, but I'm going to talk about broiler in this presentation. So here's the broiler chicken value chain in informal settings in Mozambique. So the breeder farms produce eggs, which will go to commercial hatcheries and farms, and then chicks will be sent to medium-scale farms or outgrowers, and then the chickens will go to commercial abattoirs. And then the commercial hatcheries farms or commercial abattoirs send the chicken meat to grocery stores and restaurants, which household purchase. And then from the commercial hatcheries and farms, chicks will be transported to depots where the young chicks will be raised. And then they will go to small-scale farms, and then the meat will be sent to grocery stores and restaurants. Then the chickens will be transported from small-scale farms to households. Also, the live chickens can be purchased by the live and informal markets, which will be then sold to corner stores. Corner stores are like street stores in Mozambique. And then the households, families purchase chickens, live chickens, or chicken meat at the live informal markets or corner stores. And another source of chicken products is the importation. So Mozambique imports chicken meat or live chickens from Zimbabwe, Zambia, South Africa, Brazil, and Portugal. And then if you could take a closer look at these points, these marks of children indicates where children had contact with chickens and their products, which are at small-scale farms and live informal markets and households. So children had opportunities to be exposed to chickens and chicken feces and pathogens carried by chickens in these locations. Then the second research question was, where along that chicken value chain are key poultry-associated pathogens found? So in order to find that out, we conducted a qPCR testing, and we collected 75 carcass rinse samples and 136 fecal samples, and we tested them for Salmonella and Campylobacter jejuni and coli. And so we collected the samples from depots where young chicks are raised, and then small-scale farms, live informal markets, grocery stores, corner stores, and households. Oops, sorry. Then this is what we found. It's a little bit difficult slide to look at, but basically at depots where the young chickens are raised, we didn't see any Campylobacter or Salmonella. And then when they moved to small-scale farms, 61% of chicken feces were contaminated with Campylobacter. So 61% of chickens were infected by Campylobacter. And then when we moved to live and informal markets, the contamination level of chicken feces with Campylobacter was 100%, and then Salmonella was 23%. And when we tested the chicken carcass rinse samples, so the chicken meat, the contamination level for Campylobacter was also 100%. So the message from this slide is that contamination level increased as chickens progressed along the value chain. So it started from 0 and then increased as we moved to the downstream of the chicken value chain. And then we tried to answer what is the risk of childhood exposure to enteropathogens of poultry origin, and what are the potential strategies to reduce the risk. So as we said, zoonotic pathogens are hard to control because they can be transmitted through various routes. It's not just from person to person, but pathogens can be transmitted through water or soil, or the food as well. So what is the most effective way to mitigate health risks when pathogens can be transmitted through various different pathways? So to answer that kind of research question, transmission dynamic model becomes handy. And here is the transmission dynamic model for One Health research targeting Campylobacter and Salmonella. And it does look a little bit complicated, but it's actually not too bad. Basically, the transmission model can track how many people are susceptible to infection and how many people are infected and how many people shed pathogens into the environment. So this model can track the number of people in each day based on the model parameters that are estimated. But basically, the unique aspect of this transmission model is that it can track the infection through the person-to-person transmission or through contaminated water or soil, food, or live chickens or other sources separately. So we can understand different contribution of each transmission pathway to the human infection. And And what can we do with that kind of transmission modeling? It can tell us the potential impact of intervention to control Campylobacter and Salmonella in this setting in Maputo, Mozambique. So this figure is showing what would happen when transmission through each pathway is reduced. So it's a busy figure, but if we look at these data points here, it tells us how much the prevalence decreases after reducing each pathway by 50%. So there are 5 different pathways, person to person, or through the contaminated water, or direct contact with the live chickens, or through food, or other. So these are 5 transmission pathways that we are evaluating. And then the interpretation is that if we reduce the foodborne pathway by 50%, the total Campylobacter infection could decrease by 30%. So this is the number shown by that red triangle right there, down bottom. But reducing the remaining pathways, like water and chicken and person-to-person or other pathways by 50%, doesn't really change the prevalence much. So these figures highlight the importance of controlling foodborne transmission in order to mitigate health risks from Campylobacter and Salmonella in this setting. Then we held the stakeholder meeting to discuss strategies to mitigate health risks in Mozambique. And we discussed how our findings can be used to inform One Health interventions with local stakeholders in Mozambique. So we had a meeting with the Ministry of Health and Ministry of Agriculture, Municipality of Maputo, and Consumers Association and universities. So we gathered and shared the research findings with these stakeholders, and we discussed what can we do to actually make the change in this setting in Mozambique. Right, so this is a conclusion slide, and sorry about the title, but the role of the chicken value chain in childhood exposures to enteropathogens. So the food security efforts have, so far, the food security efforts have focused on access with less attention on safety. The mitigation strategies can include the household setting, but should also target processes upstream that may contribute to household exposures. So far, what we have been doing is that we have been asking household members, mothers and children, to wash their hands to stop the transmission from animals or soil or food and water. But we didn't really address the upstream issues, which is the community level contamination of pathogens. So even if the mothers and children are washing their hands at home, if the meat coming from informal wet markets are always contaminated, it's really difficult to reduce health risks. So far, this field of research has been telling people to do their job, washing their hands and using clean water and wash their veggies and so on. But then we didn't really address the community level issues. And this study highlights that the meat and chicken products, eggs, are already really highly contaminated at informal wet markets, largely because of the lack of infrastructure, access to clean water, and so on. So this study highlights the importance of addressing that kind of community level issues instead of asking household members to do everything. Right, and then contaminated chickens have the potential to seed household transmission, as I said. And then these One Health strategies are necessary to ensure food safety as well as benefits and well-being, especially among vulnerable populations. As the Bill and Melinda Gates Foundation's presentation stated, that chicken products or the agriculture is really, really important source of nutrition and income and well-being. At the same time, we need to do our work to make sure that people can access safe products, safe animal protein. So yeah, I'm very happy to take questions, and I'm very thankful for the collaboration between the US and Mozambique and different universities, and also the funding from the Gates Foundation. So thank you so much for your attention.
Shioda 先生、ありがとうございます。
Thank you very much, so Dr. Shioda. So let me move on to question and answer session. So that now, so that we have already received 2 questions so far. So while we are receiving the questions, I'd like to ask a few things. So I got really inspired, impressed, with your presentations. So what I feel is the surveillance of the chicken chain, value chain, and the behavior of children, and this is connect these things, and what kind of pathways. So the Campylobacter and it can be transmitted what kind of the pathways and the statistical approach and in order to prioritize and the strategy. So to visualize and those findings and can be used as an educational tool in the community, which is really interesting. And this is a great example of One Health. And I'd like to ask you, what was the most challenging part in this project? And another question is, so Dr. Matsunaka is here as well. And so the non-official and market antibiotics used. And what about the issue of AMR? And could you share about these issues? So that is the most challenging things. I also experienced a lot of the difficulties and the informal market. So the informal market of the chicken value chain and the local people, even local people, have no idea about the system. So nobody in the local people and even in the government people have no idea the where and the risk, the majority of the risk located. And so the first of all, and we need to locate what is the where and the location of pathways for the 77, I conducted interviews on the 77. So where do you buy and purchase your eggs, the chicks or the chicken products, and what are you dealing with? The chicks, the meat, or the living chick? And it was a really difficult, challenging study, but it is really rewarding. I visited the site directly and to see whether the children have an opportunity to be exposed in the feces of chickens as well as the living chicken. So that I witnessed the type of risks existing in those spots, and this was really meaningful. And the second question is the antibiotics, so that they are it is really important, and actually antibiotics have been used, but so that there is no other data available. So the Mozambique as well, and the AMR is a really important issue and to be addressed. So the samples collected in in this research has been stored in the freezers, so that we can check whether they contain the antimicrobiotics. So that we are conducting the research, and so that we have received numerous questions and the Campylobacter and the Salmonella related to that. So the questions about that, and in Japan, so the food poisoning caused by the Campylobacter, so the so that it is possible to raise a chicken so the free from the Campylobacter. So the thinking considering and developing the vaccination against the Campylobacter and for the chickens, but the total free environment of Campylobacter is really difficult. And once the Campylobacter enters the chicken farm, so that within a few days, so that most of them got infected. So that it is really difficult to control the Campylobacter. So the carrier and the wildlife, and so the carry and the Campylobacter and will infect the chickens and in the small scale farms, and it is really difficult. And so what I found really interesting in my studies is the informal wet markets. So that we so that as Dr. Tracey shared the pictures, so which shows the sanitation and is poor. The 100% of the chicken meat is infected and transmitted with the Campylobacter. So that they got slaughtered and processed in the intestines and the intestines and got in contact with the meat. So that in those cases to beef up the sanitation system, and it could help and reduce the transmission rate. And so that we are encouraging the stakeholders in the Mozambique to do that, but so that it must so the regulation is not established at all in Mozambique, and so the regulation so the informal market doesn't have the license or an accreditation, and so the thorough approach and taking a thorough approach and really is really difficult and really challenging. And so related to that, and Carbona and the Campylobacter. So there is an issue, and so for the human and infection. So what about so that it is not designated as so that livestock the diseases. So what about the well-being of livestock? So the Campylobacter and especially. So in case of avian flu, so the ones got affected and the birds, it is really so the fatal for birds. But in case of Campylobacter, and it is so that they don't get killed after infected, and so it is difficult to comprehensively address those so the pathogens, and for the well-being of and the animals, and there are a lot of things to address, and so that this issue has not been incorporated in the field of study, and so that this should be included in the study as well.
ですけども、たくさん来ているところなんですけども、そのモザンビークにおいていわゆる公式にそういうその工場あたりで処理をされたとか、正式な公式に認定された農場で生産された卵と肉と、そういうそのインフォーマルな卵とか肉と価格では差がありますかっていう。
Like that. And then are there differences in are there differences in prices? And well, I cannot recall, but then there are differences in prices, and a very small portion. So in a a very high market, which are purchased in a supermarket. So those are very small portion, but so people who have visited Mozambique, from outside, so they usually purchase poultry, meat, and eggs from those high-priced area. But then the locals usually buy these from the local markets and the small stores. And how about the water? or water used for the cleaning the chicken farm, and what is the state of the or safety of the water? Yes, that's a very important question. And informal markets and so do not have good access to water, because informal market itself is very large and spread out. And then in a large tract of land, there's only one water intake point. So therefore, the vendors go to the water point once every day with a big pan, and then take the water back to their stall. And because water is so heavy and they cannot fetch water so many times a day, so when they get water in the first thing in the morning, so that water stays in the bucket for the entire day. So in the morning, so there was no count of the virus, but then so every hour we checked the count of salmonella and others, and then I have seen the increase of the microbes in the water. So in the course of the day, and then at the end of the day, so there's so many microbes in the water, and that water is used for cleaning the chicken meat, and naturally the chicken meat gets contaminated. Thank you. No. Yeah, this is a very difficult issue, and yes, as you pointed out by showing the slides, and so diarrhea is a health risks for children's healthy growth, and so I understand that things could not be improved just overnight, but. So I don't know whether it's doable or not, but in any case, it's very important to control the water quality, and so if you want to just stem out the problem, yes, and well, informal market, while it poses some health risks, however, for vendors, it's quite easy to get access. And so Mozambique itself is a poor country, and so in a poor country, there are still layers of people who have least amount of income, and so they want to get income, and so they're busy doing their own work, and so it's very difficult to regulate them, such as you got to change the water and get clean water every hour and things like that. So One Health, the certification may be very good. But instead of imposing on some regulations, and some countries just provide some beneficial treatment or preferential treatment for the producers who comply with the standard. So just telling them what to do is quite difficult. So therefore, we are talking with the economists to figure out how best people will maintain their well-being while continuing their livelihood. And so, yes, I'm in consultation with those experts, and yes, I think this is the dynamism of the One Health lies there. And if you focus only on human health, and you may say that, well, you have to abolish the informal market and don't buy things from the informal market. Saying is easy, but One Health together with well-being, and you really have to look at the reality and where the problems are, and then so what benefits can One Health bring to the community, and so what is going to be the best policy for the environment and for the people who live in that environment. I think the direction for our approaches to One Health may be that, and Yes, I agree with you. And so the presentation by Gates Foundation also mentioned that people who are engaged in farming, so those are socially vulnerable, and they are put in a very vulnerable position in a society. So we really have to help them, and so the policies should be designed to help them. Yes. So instead of imposing on regulations on them, so the policymakers should consider and how they can best support the vulnerable women and children. No. So we were talking about the case in Mozambique, and from your viewpoint, so when you look at the situation in Japan and the United States, so we are in a country in relatively blessed with good environments, and however in Japan, so we are not free of problems. So we have the antimicrobial, drug resistant, and issues. And so from your point of view, so you have seen many situations in developing world, and then in comparison to what you have seen, and then look at Japan and the United States, what do you think? Yes, I lived in South Africa, so therefore, so I had special thoughts about the opportunity to do my research in African countries. But I'm not saying that Japan is irrelevant, because so a lot of meats and foodstuffs are imported from abroad to Japan. And even if the meat themselves are produced in Japan, but the feed and forage are imported from abroad. And so what is happening at the source of those imports of the food stuff and then the feed for the animals and should be considered, because we don't want the feed for our animals to be destroying the environment of people abroad. So how about having a sandwich for lunch? And then so where does this meat come from? And when I eat tonkotsu ramen, and so where does this pork come from? How it is raised? I think taking a close look at what we are eating is quite important. And if consumers are become more aware, and their voice may be heard from the businesses and policymakers. And so now, in relation to that, there is one question, and so probably so there may be similar situations in other developing world, not just in Mozambique. But is there any particular reason you selected Mozambique? And so there was a prior research about the that showed the correlations between the health of children and then the way the poultries are raised. No, I just went to the association of the researchers, and then I happened to talk with a researcher in Mozambique. Then we started joint research, and so it is not that the idea came from the United States. So when we gathered at the international conferences, and so we encountered with the people from Mozambique, and then when we approached them and said, well, so these are the things what we can do with the research resources, and now the National Institute for Infectious Diseases of Mozambique are part of our research projects, and laboratory as facilities have been improved because of that. Because of the support coming from our university and our government. So this relationship has been quite fruitful, and I hope this relationship will be continued. What was your second question? So in Mozambique, so in the preceding study of Mozambique, was there any paper that showed the correlation between mobility among children and their contact with animals? Yes, there are some documents here and there, but then none of them are conclusive. But the reason why we became interested in markets is that WASH is the research discipline on WASH, water, sanitation, hygiene, and so it's an acronym, and it's one of the domains of the research of public health, and so in that discipline, and researchers in that discipline randomized controlled trials were started among those researchers, and so they encouraged the people to wash their hands by setting a tap and faucet, and in Kenya, and did a trial. However, so the establishing clean water at the tap and faucet did not immediately make people healthier, and so we wondered why, and so it was quite a shocking result, and so because we were hopeful that the water facility may make a big difference, but telling them to wash their hands every day and may not be enough, because they live in a house where a lot of contaminated foodstuffs and products are brought in, and so so even if you have the bulletproof vest, but when there are so many bullets at you, and it may eventually kill you. So this is the reason why I started studying. And so last question for me, and so the Japanese research institutes or universities and governments, and so those institutes or organizations, so if they want the support from Bill and Melinda Gates Foundation, if they want the support by the foundation, is it possible for them to apply, or is there any previous example of that? So if not, please give us advice about what to do. And well, I don't know who's been supported by Bill and Melinda Foundation, but Bill and Melinda Gates Foundation has their clear mission, and so they eliminate inequalities, and everybody on this planet should be in a state of well-being, and so therefore they naturally do not really support research projects by developed countries, and so the reason why we have been able to take out some funds from them is that our field was in a developing country, and our role in that research project was to provide them with soft skills, and the PCR facilities are there, and so the international health research in the past was that so field was far away, and then they took samples back into the United States or some other developed countries for further testing and studies. But for them, it was like they have been deprived of their resources. So therefore, so with this project that we do in Mozambique, we do not take out any samples from them, because locally the staff, the research staffs will visit the informal markets or whatever markets to get samples. And so once they come to the phase of analytics, we join and work with them.
時間となりましたので、次応答。
Thank you very much. We will conclude the Q&A session for this presentation. Thank you very much.